Peekaboo, Dr. Della here, and I want to talk about sleep. Are you having problems sleeping? A lot of people are right now, and so I just wanted to chat about it. So I want to make sure that you're thinking about why you're not sleeping and treating the cause of that rather than just jumping to melatonin or a sleeping pill and just treating the symptom of not sleeping, because there's a lot of reasons why you may not be sleeping, and if you can address the cause of that problem, not only will you help improve your sleep, but then you can also maybe reduce a symptom of something else that could go down the pipes later from that same cause. So let's talk about why you're not sleeping. So a couple really common reasons. Number one is sleep hygiene, which is just like basically what you do before bed. So if you're watching TV, those blue lights can inhibit melatonin production. So blue light blocking glasses would be a great idea. Maybe you're exercising before bed. That increases your cortisol. So you want to ideally do exercise in the morning when you wake up. Maybe you're having a lot of stress. Maybe you can't sleep because of pain. Like, these are all different reasons that we want to identify so that we can fix those. Maybe your partner snores and you really just need to kick their butt out of bed. Maybe that's why. Maybe your kids are waking you up and you need to sleep train your children so they stop coming into your room and waking you up, right? You've got to look at the reason why you're not sleeping. So the first question that I ask my patients is, are you having a problem falling asleep or staying asleep? Because like I said, falling asleep, we want to think about stress, high cortisol, which inhibits the production of melatonin, or maybe other things that decrease production of melatonin, like the blue lights from the TVs, right? Different reasons that we aren't falling asleep. If you're under a great amount of stress, maybe we've got to look at those adrenals and get them functioning better. Or maybe, some therapy or something to help you deal with your issues so that you're not stewing about them all night. Maybe writing a list of things by your bed so you don't have to constantly think about all the things that you have to do tomorrow. You can get them out of your mind, put them on a piece of paper, and then you can fall asleep easier. If you're waking up in the middle of the night, I usually see that with blood sugar issues. So those are people that usually drink wine or like to have ice cream or treats before bed. That sugar high gets them falling to sleep really nice, but then they wake up because their blood sugar is crashed. So the best thing for that is to not drink wine or eat ice cream before bed. Actually eat protein before bed instead, which actually elongates your blood sugar curve and keeps that blood sugar solid all through the night, so it's not having dips that wake you up in the middle of the night. What's another reason? There is something called the Chinese clock, and every hour or every few hours corresponds with a function of a different organ. So if you find yourself waking up like between 1 and 3 a.m. every single night, a lot of times it's even the exact same time, we really want to look at that Chinese clock and say like, hey, what's going on? What organ is during there? So 1 to 3 a.m. is liver time. So I find myself, when I know I'm not taking care of my liver, waking up at 2 a.m. like every morning, right? So I know I need to give my liver some love, and then I can start sleeping through the night again. So that's another thing, is looking at that Chinese clock, what organ it correlates with, so that we know what organ to support nutritionally or herbally, so that we can get your sleep back on track. The point of all of this is, please find the cause of why you're not sleeping. Don't just jump to melatonin or a sleeping pill. Not all sleep problems are due to a melatonin deficiency, okay? And a lot of times we don't want to give melatonin anyways because it can kind of be habit forming. We want to give maybe some precursors to melatonin to help your body make it better on its own. So I hope this is all helpful in some way. We do have sleep herbs and good quality melatonin, other supplements available on our web store, or you can head on into our office. We can figure out exactly why you're not sleeping, and we can get you fixed up. So maybe you should do that. All right, we'll see you next time. Thanks.